Now, color Doppler has artifacts like any other imaging modality. Sometimes it can be good to have these artifacts, and one of those good artifacts, in my opinion, is color aliasing. But aliasing is the result of inadequate sampling resulting from wraparound displays. But remember, ambiguous displays on the image may lead to confusion. Now, how does aliasing help us? It helps us to identify specific areas and structures in the abdomen. It can help us distinguish between arteries and vein. We can also benefit from the artifact by producing other artifacts that can help us in our interrogation of the organ or pathology in interest. Now look at this image. You have a colored Doppler image. You look at the portal vein. You see the portal vein going in the right flow, in the right direction. It's hepatopetal. But if you look at this part of the end of the vein, where the arrow is showing, you see some color map change. This indicates color aliasing. This color aliasing is not coming from flow within the portal vein. It's actually coming from a flow within the nearby hepatic artery. So this aliasing helps you distinguish between what is a vein and what is an artery, which is a good sign or a helpful tool without even interrogating the structure with spectral wave Doppler. Now we move to talk about power Doppler. Power Doppler also is available to us on all high-end equipment. It helps us to add to what we see with color Doppler. Power Doppler has advantages. It is less angle dependent. It does not suffer from aliasing, just like color Doppler. Unfortunately, it also suffers from some limitations, like you can't get information about direction of flow. You can't get much information about velocity, but it also helps us because it has a better signal to noise ratio. You can also scan at a higher gain without distorting the image. Let's look at this example of this case. This patient had a kidney transplant. Earlier during the day had a kidney biopsy, and the clinicians wants us to evaluate for left lower quadrant pain. As you can see the kidney nicely, but you cannot really appreciate what's really exactly going around this kidney. So there's a concern for hematoma in this instance. So power Doppler comes to our help. We do the power Doppler, and you can see how the kidney is nicely outlined with power Doppler, and you can see the surrounding hematoma without much of a mass effect on the kidney. Now let's talk about color Doppler advantages in general, including power Doppler. It will definitely make your exams faster. It will help you to establish a new diagnosis. It will add value to your practice. This value can be in areas like tumor resectability, liver and the pancreas, vascular injury, malformations, clots, transplants, portal hypertension, and many other areas. And the bottom line, you can get a greater diagnostic confidence, which is the most important feature why color Doppler is important when imaging the abdomen. Now, when we look at color Doppler, when we do color Doppler in the abdomen, what are the must-to-have images using color Doppler? You need to do the portal veins, splenic vein, evaluate the splenic vein direction and the level of the hilus, also at the level of the pancreas. Look at the hepatic veins with the IVC. The hepatic artery is really not important as much as the portal venous system or hepatic veins. However, this becomes important when you look at liver transplants, because that's the most important vessel you need to interrogate to evaluate a transplant for rejection or possible thrombosis. We also look at the SMA and the SMV and the celiac axis. Looking at these vessels helps us many times to localize the pancreas. When we're looking at the pancreas, it helps us identify the pancreas and may also help us localize lesions in the pancreas better than when looking at the pancreas with a grayscale alone. Both kidneys, we look at the kidneys with colored and power Doppler, but any attempts to interrogate resistive indices or attempt to measure these resistive indices is going to create a problem, because you're going to get yourself into a dilemma. What if they are elevated? What are you going to do next? Are you going to switch to evaluate the aorta, the renal arteries? Unless there is concern for renovascular hypertension, we do not attempt to do resistive indices. The abdominal aorta is also, you need to look at that so that you won't miss any potential silent aneurysms, specifically in elderly patients. Now, as you look at this slide, there are too many applications where you can use color Doppler in the abdomen, ranging from portal hypertension to vascular malformations. Even you can use it not for purposes of evaluating blood flow, but to help you distinguish between what is bile duct and what is a vessel in the liver. Let's have a look. Let's have an example. Portal hypertension. This is a very important topic, because whenever you evaluate, when you scan the liver, you have too many things you need to keep in mind. There's a large population of patients that having a chronic liver disease and maybe cirrhosis. So these things you need to look at. You look at the pattern of the blood flow in the portal vein, check if it's biphasic or reversed. Now, check if there's evidence of portal venous aneurysms, thrombosis. Make sure you'll be able to distinguish between a bland thrombus versus a tumor thrombus. Look for signs of portal hypertension, like recanalized paraumbilical vein, venous collaterals. Now remember, if you want to do this, it's a good thing to perform this using a cine loop function, or you need to confirm with spectral Doppler the change in flow. If you interpret your imaging just using static images. Let's look at this example. This video clip demonstrates biphasic blood flow in the portal vein. This indicates that there is presence of portal hypertension. This patient is cirrhotic. The reason also is to focus. There's another reason you need to focus on this slide is you look at the nearby arteries. Look at these arteries. The arteries are big and they demonstrate in color aliasing, an artifact that you can use to your advantage. Another example in this patient, we see complete reversal of the portal vein, and we can see the artery is coursing nearby and showing color aliasing. Another example of a patient with portal venous aneurysm. You can see the gray scale, and you can see on the color Doppler mixing of the signal within the dilated component of the aneurysm, and this is known complication of long-standing portal hypertension. The next thing you need to do about these patients with advanced cirrhosis is they can come down with blood clots in the portal system. If you look at this example on the right upper corner of the slide, you can see on this gray scale without color Doppler that there's an echogenic material within this portal vein. So this indicates thrombosis. Now, notice that the portal vein is not expanding. So this most likely indicates we are dealing with a bland thrombus in this patient. Now let's compare this slide to the other slide in the lower bottom here, in the bottom right corner of this slide. You can see the portal vein is coming into the liver. It's very expanded. You can barely distinguish it from the nearby liver parenchyma, but you notice that there is an arterial signal within that clot. This raises the suspicion for a tumor thrombus. And in any cirrhotic patient with a tumor thrombus, you need to always think about the presence of hepatocellular carcinoma in these patients. This is an example of an enlarged paraumbilical vein that extends all the way to the surface of the abdomen and goes all the way up north towards the chest. So without color Doppler, you may have a problem identifying that component in the abdominal wall. So color Doppler is important in this instance. Another example of portal hypertension. This is an example of massive subhepatic venous collaterals in this patient with portal hypertension and cirrhosis. Now, pitfalls you need to avoid in portal hypertension. You need to make sure that is the portal vein partially thrombosed or completely thrombosed. You need to scan with different probes, change the frequency, optimize your color scale, adjust your filter settings and gain. The second point is make sure you don't give a false impression of a portal venous thrombosis. in cases where there is sluggish portal venous flow, which is a common finding in many cirrhotic patients. On the other hand, be aware of the fact that you can falsely get the fact that the portal vein is patent while it is clotted. The reason behind that is you have too high color sensitivity, too low PRF, low filter settings, and color override will distort your image and make you believe that the vein is patent. The other one, false reversal of the right portal vein flow when sampling the right posterior branch. Be careful about this point because flow in the right posterior branch in normal portal veins will go away from your probe and will be encoded blue. And on the spectral wave Doppler, this thing is going to appear below the baseline.